Hello everyone. I'll be discussing a few eye care tips during this COVID pandemic because all of us have kind of been homebound these days, and we end up using gadgets more than what we used to do. Especially in children, most parents are concerned about their eye care and how gadgets might affect children's eyes, because the situation is not going to improve any sooner, and many more months children will have to use gadgets, and plus other thing is that apart from their schooling, kids have to spend a lot of time indoors. They are not able to meet their friends and they are not able to go outdoors. So in this process they are again getting more hooked on to gadgets. As far as adults are concerned, in adults also gadgets are playing a huge role, and work from home has become more stressful in a way, because the working hours, according to many people who are working from home, is actually more than what they would do otherwise. That is, this time spent in front of gadgets has actually increased than how they would when they were going to office to work. Okay, and another concern is that what will happen to my eyes due to the coronavirus infection, and since corona can gain entry through the eye, how can I protect my eyes during this period? So we'll be addressing all these three issues during this session. Okay, first let us start with children, how to manage their gadget time and what are the precautions to be taken, and let us also try to address some myths which actually give us a lot of stress. One such thing is that is there a lot of radiation coming from screens? Now most parents are concerned that some kind of radiation is getting emitted from these screens, such as mobile phones and laptops and even television to some extent, which can harm the eyes of children. But actually good news is that there is no such proven radiation, and just because they watch screen, that particular point cannot damage the children's eyes or adults' eyes. Okay, and also another thing is, should we give some kind of protective glasses, special glasses to cut down some kind of rays? Actually for children, because they are not going to spend too much time, there is no need for any special glasses unless your doctor recommends you. Okay, there are some anti-reflective coating glasses for prolonged working hours in front of the screen, which do cut down glare to some extent, but it is okay not to have them too. Okay, they're not really compulsory. But yes, if your child has refractive error and requires glasses, then that needs to be addressed. Okay, you need to discuss with your ophthalmologist and get it corrected properly, because if they are watching screen without their corrective glasses, then they can develop eye strain, which is not good for them and which will affect their studies and also their eye health. Okay, so and another thing is that a lot of parents are worried about getting that their children getting glasses. There's a lot of stigma about it. I would like to add this one point over here, is because see, young kids, the way they develop and all that, means their development depends on how they see and how their senses are working. So it's very important for them to see clear vision. Now it's not just about the quality of vision, but it's how both the eyes are working. Suppose one of the eyes is not functioning optimally or is not seeing clearly, then the child will not be able to complain to you, and they will be able to manage all their tasks with both eyes open, and you won't realize that one of their eyes is weaker, and that eye can stay weak all their life. And after a certain age, say 5 years or little above that, there is not much scope of improving that. So it's very important to check eyes early on, before this age, and correct appropriately the refractive error or the squint as advised by your doctor. Okay, and another thing is that children, they rub their eyes a lot. Okay, so that is a very common habit which is seen in kids, and we often tend to think that it's okay, my son has that habit, or my daughter just rubs her eyes daily in the morning, that's common, but that's not okay. We need to realize that this particular eye rubbing habit can do a lot of harm to the eyes. Now why is it so? Because the eyes of young children are softer than that of adult eyes. So if they are constantly rubbing their eyes, then it can be a form of trauma to the eye, and the eye shape can alter permanently, or these kids sometimes rarely can develop an issue called as keratoconus, wherein the cornea or the black portion of the eye in the front, what you see, can start to bend permanently, and there is no way to rectify this completely back to what it was. So it is better to take preventive action, cut down this eye rubbing habit, and you need to remind your children not to rub their eyes. But also remember that kids rub their eyes also because they have some form of allergies or irritation in their eyes, or sometimes rarely because they are not able to see clearly. So it's important to discuss again with your doctor if your child is having this habit. It is important to give importance to what your children are telling you, because children are usually have a very good immunity because they are young, and they react to external agents much more than adults do. So that is why allergies tend to be more severe in kids. And an allergy is a kind of an immune reaction to an external agent like dust or pollen or molds or some kind of, so many agents are there in our atmosphere or their environment, and they might be allergic to a specific agent which is which is present throughout the year, or few months in a year, or can be just one episode. Okay, so you need to get their eyes checked, and please avoid using over the counter eye drops casually for eye allergies and eye rubbing, because most often you may be handed over a steroid drop which can do permanent damage if it is not used properly. However, if your doctor feels the need for using a mild steroid or something, there will be a reason behind that. That is to protect your child's eyes from the ill effects of the allergy itself, and your doctor will be conscious about using the drop in a proper way and will guide you so. And remember that any doctor will be careful when prescribing this particular drop, so they will be thinking about your child's eyes health, and it is important to use these drops properly. So any allergy treatment again can take up to 2 or 3 months at a time. It's a kind of slightly prolonged treatment so that the itching and all that doesn't come back again. Okay, so another thing is how to choose the ideal gadget for online classes. Now gadgets based upon the size, you should go for a larger gadget. Okay, if a gadget is kept farther away from the eye, it is less likely to do harm. For example, a television which is a bigger screen and which is farther away is less harmful when compared to a computer screen which is more closer and which is slightly smaller, which is again less harmful than a tablet which is further closer to the eye, as well as it is smaller than a computer monitor. And the worst is mobile phones, because mobile phones, especially if the screen is small, or even regular mobile phones, the screen is very small and child has to hold the phone much closer, and this gives a lot of strain to the eyes. Now it's not just a temporary strain, but excess mobile use can lead to permanent refractive errors in the form of short-sightedness or myopia. It can stimulate this particular problem, or it can lead to progression of myopia. So we must be wary of this and avoid mobile phones to the maximum. Whatever content you want to show kids on the mobile, put it onto a larger gadget and prioritize. Okay, the use of gadgets is inevitable, but you need to prioritize. And if it's a smaller kid, avoid all kinds of content on mobile which will attract them, like apps, access to internet. They generally tend to follow what we are doing. So it's better to keep all these apps and everything, games, off your phone screen, so that they lose interest. Instead of that, you try to use a larger screen like a television screen or a computer monitor while showing them the content from online sources, so that they will be able to enjoy useful content, what you want to show them. Okay, that is one way. Plus avoid using mobile phones in the break time when they are having online classes. Avoid using any other gadget. You must insist that they get up from their place, go around, or look outside, like from a window, look at the distance. Okay, so seeing distance is a good activity, and it is going to help your child prevent problems from excess gadget use. By looking at the distance, eyes tend to relax, okay, and also you need to tell them to take frequent breaks. Now the light of the gadget also matters. Suppose the brightness level is it should match with the external light, okay. So children should not see bright, children or adults, these things are actually common for both. So you must not look into a very bright screen in a dark room, okay. Ideally the light or brightness level in your screen as well as the external lighting should match. You can in fact further dim the light a little bit if you feel it is too glary or strenuous, okay. And also see that the child is seated in a comfortable, well ventilated place and not a dark corner where they may lose interest in their classes and feel demotivated. So let them sit, maybe preferably, you know, on the dining table. Of course there should not be other disturbances there, or at the study table next to a window where they can look outside now and then. You can keep it interesting, tell them, you know, look outside at some mountain there, or count the sheep, or look at the vehicles there, so that they see farther away. You know, they have something to look at, okay. An easy rule to remember is the 20-20-20 rule. Actually this means that every 20 minutes we are supposed to look at the distance for about 20 seconds. And what distance should we look at? It's around 20 feet. So a point which is kept farther away, farthest, or it can be some kind of a picture or some cartoon photograph which can be put up in their room where they can, you know, stare at it for some time. And it is not enough to just look at that far distance for a few seconds and come back, but they need to look at a distant point for a significant amount of time so that the eye muscles tend to relax. An example for this I would like to tell is, for example, you just pick up a 2 kilo weight in your hand and just keep holding it for about 8 to 9 hours. Suppose it's something similar to how your eyes have to work in front of gadgets, okay. So it's just 2 kilo weight, you know, it's easy to pick up and hold for a few minutes, but if you continue to do it the whole day, your hand gets fatigued. After a point you cannot even stretch your hand, you can't even, you know, contract the muscles. This is because your muscles have got stuck in that position, or they have got so much fatigued, okay. So how can you avoid this strain? So you need to stretch in between, and you need to keep the stretch, hold the stretch for a few seconds, isn't it? Something like, you know, 10 to 15 seconds or 20 seconds, so that your muscles function properly. The same thing can be applied to our eyes. So there is a muscle which is present inside the eye, okay. There are two sets of muscle actually. Some muscles are present outside the eye which help in eye movements, and there's a separate set of muscles which is present inside the eye around the lens, our lens, okay. So this lens of ours is important because when we see near, the muscle around the lens will contract and it will make the lens more bulged, or it will make it more convex, okay. So this particular action is called as accommodation, and it helps us to read. So for our eyes, exercise means reading near print or close things, okay. But looking at the distance, on the other hand, is relaxation, okay. Or just closing your eyes is also relaxation. But if you look at the distance, your eye muscles inside your eye are relaxing, okay. So that is very important. So you need to stretch those muscles or relax those muscles, and so you need to look at the distance in between. Now many parents feel like, you know, is there some specific exercise which is required for children? You know, they ask to prevent glasses or eye problems. Actually we should focus more on their physical activity and their other exercises to strengthen their body and outdoor activities more than eye exercises, because your eyes are having very active muscles, okay. Eye muscles are working throughout the day, so you need to give them rest. Actually you need to give them breaks. But it is proven that physical activity daily for at least 1 or 1.5 hours or so, you know, especially outdoors, is helpful to prevent increase in the glass numbers or progression of myopia. This has been proven. Of course now playing outdoors is a bit risky, but whenever possible, under supervision, you should allow your children to do something like cycling, or, you know, play badminton, or keep safe distance from others, but at the same time engage them in some form of outdoor activity at least once in a day, okay. So that is one thing. And Yeah, also make sure if your child has glasses that it is snugly fitting, okay? It should not be loose or it should not be, tilted. The way they wear them is also important, okay? So, and some things I would like to tell for adults is when you are viewing gadgets, okay, so the same principles of taking frequent breaks apply during your work applies. So you need to look at the distance in between, you need to get up from your place and go around and come back. This is important not only for your eyes but also for the rest of your body, okay? It's not good to just sit in one place for so many hours together. It can lead to multiple problems and health issues eventually. Optimum level of fitness is extremely important. With regard to gadgets, I would like to say your posture is extremely important. Now, a common mistake is most people who use gadgets, they tend to bend a lot like this, okay, like viewing a mobile phone, looking in this way, or they just try to sit like this, slouching forwards. Now, this is a very bad position. If you observe my neck, my entire weight of the head is falling on my neck, okay? This is not good on a long run, and I will develop neck issues and pain, headaches in the back of my head. And this is very commonly seen actually in gadget users, and nowadays even children are complaining. What you can remember is, you can just remember to tuck your chin back and just move your chin back so that your entire head and neck and your spine are aligned, okay? This is a very easy thing to do and remind yourself, so each time you just slouch, you just remind yourself, and after some time it becomes a habit to sit straight. Your back should be well supported when you are sitting in front of the gadgets or computer. If you are using tablet, or if your child is using a tablet, then you should put it on a stand, and mobile phone also on a stand, so that you don't have to hold it in some odd position. And the gadget should be ideally around few degrees below the eye level, so that you comfortably look slightly down to the gadget and not too much down like this, okay? So also just be aware that when you're doing household activities like in the kitchen, chopping vegetables or doing some other chores, many times you are bending your neck, so this adds on to the strain of your gadget use and your work from home actually. So posture is important everywhere, okay? And also, yes, fitness and health of your shoulder muscles and your neck and the upper back strength is extremely important to prevent these problems. So proactively keep yourself healthy. Tell your children also to do what is needed, so exercises to keep them fit and avoid these problems, because all of them are going to use a lot of gadgets in future. Your elbows and hands should be supported, and if you are using a mouse, even your hand and wrist should be well supported. Another thing is feet should be flat on the ground. This is very important, otherwise your back can get into trouble over time, okay? So for children, as they are smaller in size, their legs are dangling many times, and we feel it's just a child, we don't pay importance to their posture, but it is very important to support their legs. You can put a stool or raise something below their legs, so their legs are placed flat on that surface, and they will be more attentive and more comfortable like that. So another thing what I want to talk about is the healthy blinking methods or blinking practices. Now we generally do not give so much importance to our blinking. It happens involuntarily, okay? Throughout the day we are blinking, and there is a complex mechanism involved in our in the way the eye surface is maintained due to the blinking. So there are glands in the margin of our eyelids, okay? These glands, many of them are in a row in the upper and the lower eyelid, and they open in the margin of the lid. They are oil secreting glands. So each time we blink, what happens is a tiny amount of oil gets liberated into the onto the eye surface, and there is also a tear layer or a watery layer on the surface of the eye, which is adherent to the surface of the eye, okay? And on top of this there is a layer of oil. So each time our eyelid blinks, so it is spreading a healthy layer of oil, as well as it is lubricating the entire surface with the tear film, okay? So if this oil layer is missing, then our tears are going to dry up faster. So if we are using gadgets, what happens is we forget to blink, or we blink much less than what we are supposed to do, and this is happening throughout the day. Okay, and another thing what we may do is incomplete blinking. Most often, maybe one eye or both our eyes, we may not be blinking completely. Okay, we might be just doing half blinks like this. Okay, so the lower portion of our eyes again go dry. With time, this causes permanent changes on the eye surface and also on the lid margins. These glands, which were supposed to be milked out with each blink, now because of reduced blinking, their openings get clogged with oils, and they're not doing their function, and eventually they undergo some permanent changes as well. So it is important to cultivate the habit of blinking completely. It's not easy to remind yourself each time, but you should try to do that, and also remind your children to blink properly. Okay, so in spite of all these precautions, if you're getting grittiness in the eye, sandy feeling, you're feeling some kind of a pricking, then it could be due to dry eyes, and you can consult your doctor, and you can use some lubricants or whatever extra is necessary to protect your eyes. Nutrition wise, actually a healthy diet consisting of fruits and vegetables and adequate fluids are sufficient to keep your eyes healthy. Plus, indoors these days we might be deficient in vitamin D, so you can check with your doctor how to take supplements, and you can take supplements and even ask the same for your children. So it does have its effect on immunity, and to some extent on the sensitivity of eyes. There is some kind of recent literature on this, so you can do that. So now, how can we protect our eyes from coronavirus entering the eyes, and what are the things we need to look out for in this particular pandemic with regard to that particular issue? Is it's good to wear protective goggles when you go outdoors, okay, or when you are in a group of people, or if you are going to any place where you feel there might be a risk for the viral infection. The reason for this is one, airborne transmission also may play a role in infection these days. That is the current information that we are having, right? So if somebody sneezes or coughs, the droplets which are suspended in air can settle onto our eyes, or otherwise we may put it, we may just introduce the virus by touching our eyes. Without our knowledge, we tend to touch our face and eyes multiple times in the day, especially children can also do that. So by wearing protective glasses, we might be able to avoid touching our eyes, because there is something in the way and you get reminded, and also you can prevent this particular issue of things settling on your eyes. So that may be a useful thing to do. And second thing is, yes, avoid touching your eyes, or correct the problems where you tend to touch your eyes or rub your eyes, like allergies, dry eyes, so that you don't do that. And other thing is, for contact lens users, it is better to discontinue contact lens for a while, because the contact with the you are cleaning the lens, you're putting in the lens. There are multiple times when you are there's a high chance of you infecting your eye. Okay, if you're going out, or even if the virus is there on your hand, then it's better to avoid lens whenever possible. And suppose your eyes have become red now, you've developed conjunctivitis or red eye, you can consult your doctor. There is an option for online consultation with more doctors, and with most doctors, and if needed, the doctor will see you in the hospital or clinic with all precautions. And one thing is that, see, the coronavirus itself is not known so far to damage the eyes in any way. So it may be a regular kind of a conjunctivitis somebody will go through, and you may get cured also. Most often the conjunctivitis or red eye may be due to the regular conjunctivitis virus which is going on now. Most often it is that. But suppose it is due to coronavirus, you are worried. So your eyes are not going to be harmed. You have to look out for other things like breathlessness, cough and fever, and you need to report to your physician accordingly. That is anyway there. There is no need to panic. And what you need to take care of is prevent spread. Suppose by chance it is the virus, then what is important is you should not allow it to spread to another person. So that is more important and crucial at that point. You need to wear a mask if you're having some kind of cold or cough, and even within the family members, you kind of slightly be careful for a few more days to see what is happening. And the tears can have the virus, so don't touch your eyes. Just clean your eyes a couple of times in the day, and keep your eyes clean and hands clean, and wear goggles throughout the day so that you don't touch the eyes. So that is the thing. And most often coronavirus infection of the eye or this redness will happen along with other things like cough, breathlessness. It comes a bit later when you already know that you have the viral infection or other symptoms have developed. It's very rare for you to have only redness due to coronavirus, of the eyes. So though it is known to happen, it's a bit rare. Okay, it's more likely to happen much later in the disease process. So you already have other symptoms and you would have taken help by then. Okay, so these are some things I would like to stress upon. And so it's okay to use gadgets, but use them carefully and prioritize on what gadgets you have to use. Take frequent breaks, keep fit, and take care and be happy.